What's going on, world? What's up? What's up? What's up? You already know today is Monday. I had a dream that a bunch of y'all would be here. A bunch of you guys would be here, to get your learn on. So you should kind of be here to get your learn on this good old Martin Luther King Day. Welcome, everybody. You guys already know what we're doing. We're doing NCLEX questions. So shout out to everybody that came to the cardiac medications lecture yesterday. We were on there for about a little over an hour. No, we're about an hour and a half. And let me tell you, it was a good time. Everybody there, they enjoyed it. Hey, so if you guys were there, expect to get the lecture. It's going to be emailed to you so that way you guys can refer to it. All right. I didn't forget about y'all. I'm a one-man army, so I'm just trying to make some stuff happen. Hey, you guys already know what the deal is. I need 1,000 likes. I need 100 people in here. If I don't get either one, I ain't doing no questions today. Not even playing. But of course, I want to know everyone that's in here. I want to know who you are, where you're from, where you're at in your nursing journey. My name is Kevin. I go by the boot nurse. I mean, you can call me Kevin, Nurse Kev, whatever. Hey, what up? Kev's here. What up? Been a nurse 3.5 years, worked ICU, OR, and I worked in the PACU. And I'm here to give you guys some knowledge today. You know what I'm saying? Just because it's Martin Luther King Day and most of you guys have a day off, remember that he had a dream. All right. He had a dream. We're talking about segregation, desegregating, everybody being as one. But guess what? I had a dream, too, that you brought that ass here. That way we can get this learn on. All right. It says Arnisha Gibson. Hey, shout out to you. That's my last name, girl. That's what I'm talking about. 5th time test retaker. Hey, shout out to you. Welcome. Hey, I failed my NCLEX 3 times, y'all. Three times. And trust me, that was my fault. And guess what? It's your fault. But what are you going to do to fix it? That's not even me trying to throw shade at you, but it's the reality. Like, what are we going to do to fix it? You know what I'm saying? You're going to make it. I made it. Everybody else made it. Hey, it's on. We almost there, y'all. We almost there to my 1,000 likes. Once we get there, I'll turn it around. But like I said, I want to know who you are, where you're from, where you're at in your nursing journey, and then we will get this on and popping. All right. Also, if anybody wants to check out the lecture, you guys can go and check out that lecture. That lecture is on thebootnurse.com. You guys can check that website out. Oh, here we go. Everybody is here. I got 1,000 likes, so let's see what the deal is. Of course, you guys know we do these every Monday, Wednesday, Friday, 5:30. Christelle, like the champagne said, that they start nursing school tomorrow. Hey, that's cool. Hey, I started my master's program today. Like, officially, I started my master's program today, so y'all know what's up. Here we go. It says, now, why it look like you done got to fight and catch? What you mean? Is it me or is it keep freezing? It might be you. I don't know. It says from Texas, 3rd time test taker scared. Hey, if you scared, go to church. Here we go. Question number 1. Nurse John is caring for a client in an outpatient clinic. Which of the following phone calls should the nurse return first? All right. So this is essentially a management of care. Who do I see first? Who do I call back first? Who is going to die if I don't see them first? Right. Is it A client with hepatitis A who states my arms and legs are itchy? Is it B, a client with a cast on the right leg who states I have a funny feeling in my right leg? Is it C, a client with osteomyelitis of the spine who states I am so nauseous that I can't eat? Or is it D, a client with rheumatoid arthritis who states I'm having trouble sleeping? What do we think it is? Shout out to all 400 plus of you guys. Hey, we're on the road to 10,000 likes. All right, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time I got to the 10th question, I will boycott. Hey, there's a lot of boycotts that happen. We do sit-ins around here. You know what I'm saying? Today might be the day for that. You know what I'm saying? 10,000 likes. All right. Hey, also, I got these questions off nurseslabs.com. Nurseslabs.com, free sets of questions. You guys can go over there and check those questions out for yourself. Candace, don't come up in here and tell me to stop. Girl, you stop. You know what I'm talking about? What's up, Ebony? I see you. All right, y'all. Let me give you guys 10 more seconds. Could be, okay, DBT. Thank you for the flower, Ebony. I appreciate you. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. Oops, just kidding. There we go. And the answer is B, a client with a cast on the right leg who states I'm having a funny feeling in my right leg. Right? It's like this may indicate neurovascular compromise requiring immediate assessment. This is a management of care question. Management of care is the largest section on the NCLEX exam at 18 to 23%. All right. You may see some numbers that are kind of skewed, 18 to 23 or 15 to 21. Regardless of the fact of those numbers, management of care is the largest section for the client needs. Okay. How are you this week? Hey, the week just started, so you already know what's up. So shout out to everybody that is here and got that answer right. Remember, you need content, you need Q&A rationales, right? And you need to put in the work. No one's going to give this to you, right? You need to put in the work. All right, here we go. It says, how do you remember all this as a nurse? Practice. All right. Question number 2. Nurse Sarah is caring for a client on the surgical floor and has just received a report from the previous shift. Which of the following clients should the nurse see first? Okay. Once again, I'm starting to see a theme. Wait, who said that they passed their NCLEX? What? Who was it? Cooper? Somebody passed their NCLEX. Hey, whoever passed their NCLEX, let me see that again. All right. Is it A, 35-year-old admitted 3 hours ago with a gunshot wound, a 1.5 centimeter area of dark drainage noted on the dressing, a 43-year-old who had a mastectomy 2 days ago, 23 mLs of serosanguinous fluid noted in the JP drain, a 59-year-old with a collapsed lung due to an accident, no drainage noted in the previous 8 hours, or is it D, a 62-year-old who had an abdominal perineal resection 3 days ago and client complains of chills? What are we thinking? Shout out to all 400 plus y'all in here rocking with me. Whoever just passed their NCLEX, congratulations to you. Welcome to the greatest shit show on earth known as nursing. All right. And also, for those that passed their NCLEX, come in here and tell us so we can give you all the praise and all the love, because trust me, it is not a joke and it's not easy to pass this exam. For some people it is easy, for most it is not. Okay. So don't let other people project their thoughts on what is difficult for you, right? So some people will tell you that it's easy. Some people will tell you that it's not, but everybody is built different. You know what I mean? So if you, for those persons or people that passed the NCLEX, let us know that one thing that helped you, get over that hump. All right. It says, I failed first time, been an RN for 26 years. Shout out to you, Cherry. Look, I failed 3 times and I passed on my 4th. I failed 3 times, passed on my 4th, and been a nurse for 3.5 years. And you're patient, and nobody will ever ask you, ever. They will never ask you, hey, how many times did you take that exam? Because it doesn't matter. Here we go. But the answer is D, a 62-year-old who had an abdominal perineal resection 3 days ago who complains of chills, right? The client is at risk for peritonitis and should be assessed for further symptoms and infection. That is management of care. That's what I said. Okay, I hear you. All right, so that's management of care. So for those that are going to sit here and may argue with me and be like, oh my God, I don't believe that's right, Kevin, it's stupid. That's why you read your rationales. Don't sit here and argue with me, all right, because I don't argue. I will troll you and I will ban you, but don't argue with me. You know what I'm saying? That's what it is. I second guess myself. Nick, you can't be doing that. Hey, usually your 9 times out of 10, your first answer is your correct answer, okay? Question number 3, Nurse Eve is caring for a client who had a thyroidectomy 12 hours ago for the treatment of Graves' disease. Now, paint the picture. Where's your thyroid at? Okay, now based off of where it's at, what issues do you think would arise once I took my thyroid out? Okay, the nurse would be most concerned if which of the following was observed. Is it a blood pressure 138/82, respiratory rate of 16, temperature of 99? The client supports his head and neck when turning his head to the right. The client spontaneously flexes his wrist when the blood pressure is obtained, or the client is drowsy and complains of a sore throat. What are we thinking? Shout out to everybody in here. Appreciate y'all. Another little thing about me, y'all. I actually just got out of the Navy. I just finished with my terms of service, I guess. So I did 16 years and 4 months. I was an instructor in the Navy, master instructor. I actually been teaching for 9 years. And this is why I do TikTok. A lot of people ask me why I do TikTok, and I love it. And that's why it's because it's my way of teaching and to give back to my community, whether they be veterans, whether they be nurses, whether they be surge techs, anything medical like that. And that's why I do it. So shout out to all y'all for being here. But here we go. Here is our answer. Keisha, thank you for your support. Appreciate you. And 3, 2. And the answer is C. The client spontaneously flexes his wrist with the blood pressure, when the blood pressure is obtained, right? Is a carpal spasm, indicates hypocalcemia. Now, what's the other name for that? Aisha, thank you. Got it. That's what I'm talking about. Period. Trousseau's, there you go. Trousseau's, it says good. It says, yes, good job. Nurses in the comments. That's what I'm talking about. Shout out to y'all. And here's the thing. If you don't remember these things, that's okay. Shout out to all my nurses that are out there working who have probably never seen this in years or probably just, said, fuck it and forget it. You know what I'm saying? Like, it's okay to come in here and test yourself and you'll be like, shit, I need to go back and I need to learn the basics a little bit. That's cool. You know what I'm saying? So don't let people come out here and be like, how do you not know that? You tell them to go fuck off. You see what I'm saying? So here we go. Question number 4. Julius is admitted with complaints of severe pain in the lower right quadrant of the abdomen. All right. So what's hanging out in my lower right quadrant? To assist with pain relief, the nurse should take which of the following actions? Encourage the client to change positions frequently in bed, administer Demerol 50 milligrams IM Q4 hours and PRN, apply warmth to the abdomen with a heating pad, or use comfort measures and pillows to position the client. What are we thinking? What are we thinking? Hey, we're on the road to 10,000 likes. Hey, 10,000 likes. But if I don't have 10,000 likes, by the time we get to question 10, I'm going to Martin Luther King this whole thing. And I'm boycotting. Y'all didn't think I was going to say that, huh? Y'all already know what the deal. Shout out to y'all. Hey, today's a historic day. Make sure you guys understand. You guys appreciate that. All right. Somebody said, no, I know I'm out of pocket for that. I'm sorry. My bad. It's Monday. All right, y'all. I'll give y'all 5 more seconds. Here we go. Here we go. Here we go. Here we go. And 3, 2, and the answer is D. Use comfort measures, right? Use comfort measures and pillows to position the client. Using comfort measures and pillows to position the client is a non-pharmacological method of pain relief. Remember, when you guys are doing your questions, you need to, first of all, you have to get the content. There are no tricks to learning this. You have to understand the content, apply that content to the question, right? And then you use the questions, go into your rationales to retain the information of why you got it right and why you got it incorrect. Okay. Physiological adaptation, which is 11 to 17% on the NCLEX exam. All right. Which is the 3rd largest section of client needs from the NCLEX test plan. Okay. So you guys have got to be familiar with that. Hey, once you see how the questions are written, it's no new news to you. You know what I mean? So question number 5, Nurse Tina prepares a client for a peritoneal dialysis. Which of the following actions should the nurse take first? What is the very first thing I should do as the nurse before we start this peritoneal dialysis? Is it assess for a brewery and a thrill, warm the diacylate solution, position the client on the left side, or insert a Foley catheter? 10,000 likes. That's what I'm talking about. All right, now give me 20. Give me 20,000 likes. Get carpal tunnel for me. Y'all saw how passive I just got? Because I'm talking real nice to y'all. Make it happen. Make it happen. All right. So what do we think the answer is? All right. By the way, I got these questions off nurseslabs.com. They're free sets of questions. You guys can go over there and check those out for yourself. Also, if you're a nursing student and you haven't shared this, what are you doing? I don't care how you feel about people in your cohort. You just started school. For most of y'all, share it out to people. You know what I'm saying? Somebody said you're getting carpal tunnel for me. That's what I'm talking about. Here we go, y'all. Here's our answer in 3, 2, and the answer is B. It is the warm the diacylate solution. Cold diacylate increases discomfort. The solution should be warmed to body temperature in a warmer or heating pad. Do not use the microwave. That is part of physiological adaptation. Physiological adaptation, which is the 3rd largest section on the NCLEX exam at 11 to 17%. Here. Hey, I have literally, listen to me. I have literally seen people put diacylate in the microwave. Do not do that. Ever. People are just saying to make me mad. Danielle, yeah, because that's exactly what they're doing. They just doing it to you. But hey, here's something I need for y'all to realize is that everyone that is in here is at a different stage in their nursing career, whether they just today said they wanted to be a nurse, to being in high school, to not being a nurse at all, to already being a seasoned nurse and already in school. So some people don't know, and that's okay. We got to meet people where they are to help them grow. That's something that everyone needs to realize as they go through school, nursing, fucking life. All right. But by the way, hey, I got some testing tips over there to help you guys conquer the NCLEX. It's a free download. It's 42 pages. You guys go over there, look at some of those keywords, those key concepts, those labs, those things to help you out. thebootnurse.com/test. Remember, conquering the NCLEX, the path of conquering the NCLEX, it begins with you. Stop playing with me and stop playing with yourselves. Pause. Y'all know what I mean. Happy Martin Luther King Day. What do we got? In Malaysia and Singapore taking the NCLEX license in the U.S. Any advice, guys? Hey, y'all give her some advice. Y'all know what's up. Nurse Jana teaches an elderly client with right-sided weakness on how to use a cane, right? Which of the following behaviors, if demonstrated by the client to the nurse, indicates that teaching was effective? So what did the client display that was correct, right? So one thing that they did was correct, right? The client holds the cane with his right hand, moves the cane forward, followed by the right leg, and then moves the left leg. Client holds the cane with his right hand, moves the cane forward with his left leg, and then his right leg. The client holds the cane with his left hand, moves forward, followed by the right leg, and then moves the left leg. Or the client holds the cane with his left hand, moves the cane forward, followed by his left leg, and then moves his right leg. Man, I know that's a tongue twister and a lot of reading. So what do we think? Shout out to all 500 plus of y'all. For those that are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. They're free sets of questions. You guys go over there and check those out. And like I said, hey, they also have care plans over there. So I use care plans. Everybody use care. Trust me, everybody and their mom has used care plans off nurseslabs.com. Okay. I don't care what your professors or your teachers tell you. It's not cheating. Like, I mean, it's a tool for you guys to utilize. It's not like you guys are What's up, Ashley? Ashley, you got news to tell us? Tell us what's up, Ashley. Tell everybody in here what happened. What are we thinking? All right, I got some C's. I got D, A, 20K. That's what I'm talking about. You already know what the deal is. Keep going, keep going. And the answer is C. The client holds the cane with his left leg, moves the cane forward, followed by the right leg, and then moves the left leg. The cane acts as a support and aids in weight bearing for the weaker right leg. That is health promotions and maintenance, which is 6 to 12% on the NCLEX. It's lower within the 8 sections. Okay, it's lower within the 8 sections of the NCLEX test plan, but still part of the 8 sections and still very much important because we need to promote safety and we need to promote the maintenance of health for our patients so they don't create any other types of problems for themselves. All right, here we go. So shout out to everybody that got that question correct. Here we go. Question number 7. An elderly client is admitted to the nursing home setting. The client is occasionally confused and her gait is often unsteady. Which of the following actions, if taken by the nurse, is most appropriate? Keyword. The key word is most, right? Is it Kiana says, I second guess myself? What's the last answer? I don't know. We don't go back. Just like NCLEX, we don't go back. So I don't even remember what that question was, to be honest. Here we go. Ask the woman's family to provide personal items such as photos or mementos. Select a room with a select a room with a bed by the door so the woman can look down the hall. Suggest the woman eat her meals in the room with her roommate or encourage the woman to ambulate in the halls twice a day. What are we thinking? Remember, which one is most appropriate? What is the most? All right, what are we thinking? I'll give you guys 15 more seconds. If you guys are new here, welcome. Doing NCLEX questions. Got them off nurseslabs.com. Hey, make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. I'm telling you, when you share and you follow, TikTok is just like, what he doing over there on this Martin Luther King Day? Or shit, let's send some people over there. You see what I'm saying? It helps with the algorithm, all right? So make sure you guys keep pushing that over there. A is the second best. Okay, it's the second best. All right, well, here we go. Let's figure out what the answer is in 3, 2, and the answer is A. So actually it is the most, right? Ask the woman's family to provide personal items such as photos and mementos. Photos and mementos provide visual stimulation to reduce sensory deprivation. That is physiological adaptation, which is what is the third largest section on the NCLEX exam at 11 to 17%. Somebody said we need more information. Look, you can need all the information you want. However, that's all the information that they give you, and you have to be able to work through it. You guys need to realize is that NCLEX is about critical thinking and applying your critical thinking and to make a clinical judgment. All right? Critical thinking to make a clinical judgment. I don't know what y'all are talking about in here. I'm trying to figure it out. Where do I find the mark? You can find Mark K on YouTube, right? Somebody was asking about Archer or UWorld. It all just depends. Me personally, I've used both. I like Archer better. That's just me personally. Some people have failed with Archer. Some people have failed with UWorld, but there's a plethora of things that go in there. But both of them, they're pretty good. Both of them are pretty good. You're right, Kev, about NCLEX. I know I'm right about NCLEX. I failed it 3 times. Nikita, what you talking about, girl? Here we go. Question number 8. Nurse Evangeline, Evangeline teaches an elderly client how to use a standard aluminum walker. Which of the following behaviors, if demonstrated by the client, indicates that the nurse teaching was effective? So what is the client doing that is correct? Right? I'm not going to read them all. You guys just answer. I'll give you guys 20 seconds. Somebody said, how long to study in a crunch? If you're trying to study in a crunch, look, don't study in a crunch. How about that? I listened to Mark K lectures when I was driving or cleaning or doing something. Yep, that's exactly what I did. I got some people saying C's. We got some D's. Got some B's. Okay. All right, y'all. I'm thinking CNA or pediatric nurse. What? Oh, you want to be a CNA or a pediatric nurse? I don't know what that means. Sure. Whatevs. All right, y'all. Here we go. Here's our answer. Here is our answer. And 3, 2, and the answer is B. The client lifts the walker, moves it forward 10 inches, and then takes several small steps forward. All right. A walker needs to be picked up and then placed down on all the legs. That is health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Okay. So remember, when you guys are studying, here's the thing, if there's a subject that you don't understand, go back and look it up. That's called taking responsibility for what you don't know. You know what I'm saying? Go back and look it up. Look up crutches, canes, and walkers and gaits and see what it is, right? But then here's the thing. Even if you get something wrong, it's not the end of the world. Remember, you are not supposed to be perfect on the exam, right? You got to know what everybody else knows. That's the biggest thing, okay? Miss Ma'am, hi, Sarah. How are you? If you guys don't know Sarah, she's one of my mentors, SSH Mentoring. That's one of my mentors. I love you, Sarah. Appreciate you. Here we go. Question number 9. Nurse Derek is supervising a group of elderly clients in a residential home setting. The nurse knows that the elderly are at greater risk of developing sensory deprivation. For what reason? Is it increased sensitivity to the side effect of medications, decreased visual, auditory, and gustatory ability, isolation from their families and familiar surroundings, or is it decreased musculoskeletal function and mobility? What are we thinking? Hold on a second, y'all. I just saw somebody come in here try to sell me nudies, and you guys already know my policy. We don't sell me nudies when we get them for free. You know what I'm saying? Happy Martin Luther King Day. Y'all know what's up. And if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. A little bit about me. If you guys are new, I've been a nurse for 3.5 years. I've worked ICU, I've worked OR, and I've worked PACU. So, just a little bit of thing. Done a little bit of things. All right. Hey, and by the way, just because you're an RN and an LPN doesn't mean you have to work bedside. There, I said it. No part of me cares what anybody else thinks, but just because you have a license to work as a nurse doesn't mean you have to work in a hospital. So here we go. Here's our answer. Here is our answer in 3, 2, and the answer is B, decreased visual, auditory, and gustatory abilities. All right. Gradual loss of sight, hearing, and taste interferes with normal functioning. That is very true, because that's what happens as they get older. Try talking to a 90-year-old. They're going to be like, what? You know what I'm saying? Just like that. So health promotions and maintenance, 6 to 12% on the NCLEX exam. All right. Somebody said, why do I say that? Because I just did. You don't have, just because you are an RN or you're a nurse, period, doesn't mean that you have to work in a hospital. You can work anywhere. You can work anywhere. You can go work in a clinic. You can go work for an insurance company. You can work for pharmaceuticals. You can do medical devices. You can go be a school nurse. You know what I'm saying? You don't have to go to any of those, right? You better do y'all research. Here we go. Question number 10. A male client with emphysema becomes restless and confused. What steps should Nurse Jasmine take next? So shout out to anybody named Jasmine up in here. Encourage the client to perform pursed lip breathing, check the client's temperature, assess the client's potassium level, or increase the client's oxygen flow rate. What are we thinking? Shout out to all 400 plus of you guys in here rocking with me. We are doing NCLEX questions. Make sure y'all keep smashing that like button. Y'all keep sharing and y'all keep following. We're on the road to 30,000 likes. On the road to 30,000 likes. 30,000 likes. What are we thinking? But yeah, once you get a license, ladies and gentlemen, You are the chief executive officer of said license. Yes, you are. You are the chief executive officer of said license. All right, here we go. Here's our answer in 3, 2, and the answer is A. Encourage the client to perform pursed lip breathing. Pursed lip breathing prevents the collapse of the lung unit and helps client control the rate and depth of breathing. Okay, that is actually part of physiological adaptation, which is 11 to 17% on the NCLEX exam. All right, physiological adaptation, 11 to 17%, which is the third largest section on the NCLEX exam. All right, so here we go. Remember, when you guys are studying, you guys need Q&A. You need content, you need Q&A, you need rationales, because what that does, that allows for you to gain the information, apply the information, and then retain the information. All right. Hey, by the way, yesterday I did a need to know lecture on cardiac medications for the NCLEX. All right. And right there, you guys can go and check that out for yourself. Okay. And like, we were over there for about a good hour and a half. And, people asked me some questions. I went over those important things and how to remember them. You guys can go over there and check that out for yourself. It's on my website, thebootnurse.com/cardiac. All right.